Welcome to Adapt NCLEX. If you worry about the new NCLEX test plan for the 2026, don't worry about it. I got you. What the test is testing is something nursing students keep missing all the time. Health equity, bedside decision, barrier to care, ethics and consent. You've been seeing this in questions. You've been doing them. They just want to emphasize it more. It's been in the test for a while. So stick around. I will give you an example of questions, what they mean by that. And this video should be a guide that you come back to it every time. The first thing I want you to know is don't take the test because you want to beat April 1st. Your preparation is the most important. Don't let anybody bully you to take the test because you don't want to take the new one. It's the same. First thing, why this matter? This test plan. One, they want to emphasize on health equity. And I will explain to you. Equity is something people get confused with equality. Equality, everyone get the same care, no matter what. But equity, you get the care that you need specifically for you. If you go to the hospital, we give you the care that is tailored to you, not what everybody needs. Equality, that's it. But we want to emphasize on equity, unbiased care. And then what you do at the bedside all the time, bedside decisions that is being made by you, the nurse, if you're working right now. This is not politics. This is patient safety and outcome. This is what is been going on real world. They just want to bring it to the test. So rest assured, you're okay. Don't rush to take the test. Now, what NCLEX means by health equity, I've explained it to you already, but in a different form. It's a fair care based on individual needs. What does that mean? Everybody is going to get the care that they specifically need, not equality. Equality, we get the same care whether you don't need or not. We get it exactly the same. But equity is very important. When you go to the hospital, you have certain things that affect you to go to the hospital. We will see it in questions. And therefore, we got to tailor the care towards you, the individual, the patient. Identify barriers before blaming the patient. This is what they want you to know about equity. You don't know why they're not taking their medication. They don't have money to buy the medication. You can't blame them why they can't lose weight. They don't have a gym. They live far away. All these things is coming into the test, real life that you see patient. And this is it. Access to care. Why have you missed your appointment multiple times? Because I don't have a car. Language barrier. I did not understand what you were saying. All the jargons you were using, I don't understand. And cultural consideration. You got to pay attention. They may be nodding when you're talking, but that's not medicine. You want to make sure they understand. I'm going to give you 10 questions to explain this exactly. And social determinant of health. This is big word. Once again, this is a big word. If you never heard it before, all it means is what are the things that affect you to get okay? Is it money? Is it because of culture, your race, and all these things? We talk about it all the time. If done public health, they say it. Social determinant of health. This is one of the big social aspects of medicine in the US. They pay attention to that social determinant of health. Therefore, as a nurse, you should know what are the things that is affecting access to care. And this video should be something you come back to it before you take the test if you're going to take it after April. Once again, don't rush so that you can understand the terminology. I'm not going to scare you. I'm going to give you the key things that you need to know because I've seen so many things going on, but this is the easy way to understand it. Rare-ness action. What do you think? It's basically that when you talking to somebody who does not understand what you're saying, you need an interpreter service, somebody that is specialized and is certified. Don't use the family. That's all. You know it already. monitoring advanced devices still need to follow HIPAA. You can't be typing on your phone or using equipment that you don't follow HIPAA strict rule regarding that. Protect privacy and consent. That's all. That's what they're trying to do. Apply ethical principles at bedside. Once again, you've seen questions. If you've seen my videos, my 85 questions, I talk about ethics all the time. At bedside, it's the same thing. Now, I'm going to give you 10 questions. Each of them is going to illustrate what we've talked about. Which action should the nurse take to promote health equity? I told you equity is specific to the patient, not equality. Selected apply. A nurse is caring for a client who primarily speak what? Spanish, and is scheduled for what? Surgery. What would you do for this particular patient? All she speaks is Spanish and is going to have surgery. How can you promote equity? That means specific to the patient who speaks Spanish. Use a certified what? Use a certified medical interpreter. Ask the client adult child to translate. Confirm understanding using teach back. Speak louder and slower in English. Provide written materials in the client's preferred language. Stop the video, put your answer in the comment. And I know you know the answer. This is real life. You know it. Of course, if you pick the right answer, I'm happy for you. If not, let's look at the key things. Equity. I don't speak English. Well, we all know we got to what? Use a certified medical interpreter because they are the one who can interpret all the things that is needed. This is good. The child cannot do that. It's against the rule. That one is gone. Confirm understanding using what? Teach back, because I want to know if they understand it. Yes. Speak louder and slower in English. It's not going to help it. She does not understand English. She speaks Spanish. So whether you speak louder or slower, it does not matter. Provide written materials in the preferred language. Haven't you seen questions like that? This is what they like. So 1, 3, and 5. That's your right answer. Is this something you're going to freak out and take the test? And before April 1st, when you're not ready, that's all. This is right there. This is something this is what they said they're going to emphasize on. You know it already. Now, access to care. How did people get care? What is the nurse priority action? A client with uncontrolled diabetes report skipping medications due to cost. She's skipping medication due to cost. Think about it. This is affecting access to care. 1, reinforce the importance of medication adherence. Document non-compliance in the chat. Assess for financial and insurance barrier. Notify the provider to increase the dose. Test-taking strategy. You've seen my videos. You watch it. I teach test-taking strategy, how to answer question. Go for the buzzword. If you pick something that does not answer the question, you're going to get wrong. He said what? I'm skipping because I don't have money. Therefore, what are you going to do? What you're going to do? He said he has no money. This has nothing to do with education. Education is not enough. You can educate the patient all you want. It cannot afford it. Therefore, reinforcing the importance of the medication adherence is a trap, English trap right there. Document non-compliance. You are not helping the patient. He said, I cannot pay for it. Therefore, I'm picking an answer that talk about financial need. If you talk to the provider to increase the dose, he still cannot pay for it. Common sense applying to these kind of questions. You got it. Number 3 is the right answer. You see that these questions is not going to be hard. You're lucky to have them. You should be happy to get them because it's something you know. It's relatable. There's no science to it. It's just thinking about it. Selected apply. Which nurse action demonstrate unbiased, equitable care? This is bias awareness. You have to know that you may do things that may show that you're showing bias, but this is what the question is saying. Equity, I told you, specific to the patient. Therefore, what? Using person first language. What do you think? Is it specific to that patient? Making assumption based on socio-economic status because of the color of their skin or because of the money they have. Assess each client individually, right? Providing the same discharge plan to every client, asking about barriers to follow-up care. This video, I took my time so that I can explain it to you. I want you to pay attention to the words. When you see it, that's what you're going to use to answer the question. It says equity. Therefore, I explained to you that equity means what? Specific to that patient, not everyone. Therefore, if you see an answer choice that say everyone, eliminate it. Same discharge plan to everyone. You see, that's the clue. Using person first language. This is specific to them. You see, making assumption about their economic status. Why would you do that? Assess each client individually. You see, individually, that's key. Asking about barriers to follow up. Yeah, you want to figure out what is preventing, specific to him. Therefore, 5 is specific to the patient. 3 is specific to the patient. 1 is specific to the patient. Once again, come back to this video when you get a chance and understand what the NCLEX is going to ask you. So 1, 3, and 5 are your right answer. Now, cultural consideration. We all have cultures. We all are from different places. You can tell from the way I speak. But what? If I go to the hospital, I got to be afforded that opportunity, right? Just because I speak certain ways doesn't mean you're going to treat me different, right? If I said I don't eat this, you should not look at me like that. So this is the same thing. Cultural consideration. A nurse is caring for a client whose cultural belief affect dietary choices. I'm not going to eat certain food. What is the best nursing response? Then what are you going to do? Encourage the client to follow the hospital diet. The patient said, hey, I have cultural belief about diet, and you want them to follow hospital diet? Explain the medical nutrition therapy is required. Does that answer the question? Collaborate with the client to adapt the meal plan. What do you think? Notify the dietary service of non-compliance. It's not that it's not complying. He said, my cultural belief affect dietary choices. There's the key strategy, and we're talking about cultural consideration. Therefore, consider the individual culture when you're picking an answer choice. Those that sound like good are wrong answers. The key is the buzzword cultural belief. There's the key strategy, which answer you pick, you know yourself that number 3 is the best answer. You respect the individual, and the individual will adhere to the dietary choices when you give them. It's part of it. Incorporate the patient in the decision making of selecting food. So 3 is your best answer. Now, ethical consent and language barrier. You've seen it. You've seen these questions multiple times on ethics. A non-English speaking client is the same thing we saw, Spanish patient. Nod during what? Consent education, but does not ask question. All the patient do is to nod their head during consent. You don't know whether they understand. Just because they nod their head does not mean they understand. This is what the NCLEX want to emphasize on. Real life situation and social determinant of health. What should the nurse do? Proceed since the client appear agreeable. You using facial expression is a verbal consent, verbal, informed consent. Ask the family member to confirm understanding. It's the social determinant of health. It's the patient we're talking about. Use an interpreter to reassess understanding. What do you think? Document informed consent was obtained. Patient nod, he never said anything. What do you think? Which answer choice will you pick? I know you picked the right answer. And as I explaining it, I was giving you the cues to know that these are all wrong, right? Don't proceed. Don't use family member. Reassess using a specialized person. And this is not a consent. Number 3 is your best answer choice. I'm telling you, don't rush. You know the thing. When you're ready for your exams, go take it. These are little things they want to emphasize because it's real life. Select and apply. Which factors should the nurse assess when evaluating social determinant of health? Like I've said, social determinant of health, break it down. Social things around us, determinant affect you, right, of your health. What will affect you if you have like cancer and you need chemotherapy and you got to travel 2 hours? Do you think you will go to the place and get chemotherapy? These are all social determinant of health because it's far away from you. You can't drive. You need somebody to drive. There's no family member at home. Are you going to take public transportation? You can do that if you need chemotherapy. That's all. So, which one? Transportation access, health literacy, religious affiliation, housing stability, ability to afford medication, social determinant of health. Pick your answer, let me know. Stop the video, put it in the comment section, and you say, number 6, I got it. I understand the social determinant of health right now. Hashtag social determinant of health. What do you think? Of course, if I can travel, I can go and get my healthcare. If I don't understand what is going on, literacy is a problem. My religious affiliation should not affect it that much. If I don't have a house, it's a social problem. Religion is not a social problem. And ability to pay for it also affects it. Remember, religion is not. So religious affiliation is not a social determinant of health. So transportation, health literacy, no house, you are homeless, and you can't pay for it. So those are all 1, 2, 4, and 5 are your right answer. Then privacy, like I told you, they want to emphasize on new because we have so many things going on, so many electronic stuff. Everything is like EMR. So you got to be able to safeguard individual privacy information. You can't just walk around with the computer in the cafeteria while you type in patient note. No. And nurse is monitoring a client using remote telemetry, right? Which action best protects client privacy? What do you think? Share data only with authorized team members, discussing results in their own way, leaving the monitor visible to visitors, posting updates in the nursing station. Which one is best for privacy, right? Remember, HIPAA applies to advanced technology. Whether they can talk or not, it still applies to them. Therefore, you share things only to authorized team members. And that's number 1. Number 8, health literacy. We saw that education can affect it. The nurse suspects the client has low health literacy. Which action is most appropriate? It does not understand anything. I mean, language is very low. Which can you communicate with the patient? Provide detailed written instruction, use medical terminology, ask the client to repeat instruction in their own words, refer the client to the provider. You know the answer. The way I read the answer choice, you can tell. I'm trying to emphasize to you. Low literacy, how can he read? Number 1 is gone because written instruction, he can't even understand. Medical terminology is negative. He can read a book in their own words. Ask the client to repeat the instruction, reading back to you whether they understand it in their own language. Calling the doctor is not a problem. Therefore, number 3 is the best answer choice. Number 9, ethical equity decision making. We've seen it multiple times, but I just want you to understand it. 2 clients require the same limited resources, right? Which principle should guide the nurse action? They require the same limited resources. The resources is very low, but they require them. What would guide you? This is what the NCLEX want to emphasize. And I explained to you, equity means specific to the individual needs, not what everybody needs. Therefore, first come, first serve. That means what? Provider preference. That means what the doctor provide like. fair and unbiased clinical assessment, client economic status. I want everybody to try, if you're watching this video, number 9, let me know your answer before I give it to you. You said they need the same limited resources, but what should guide your decision making in the care of them? The key word is ethical equity, right? It shouldn't be first come, first serve. That is what equality. Provider preference, that means he's selecting. But the fair, unbiased clinical assessment, based on what they need specifically, you assess them and say, oh, this guy needs specific this and that and that. This patient needs this and that and that. Therefore, 3 is best. Economic status is basically you being biased. And the last one, putting everything together, which NCLEX in action reflects the 2026 NCLEX focus on health equity. The focus on health equity is what? Screening for barrier to care for the individual. Yes, that's you want to screen for barrier. 2, using interpreter service appropriately. You cannot use family member. Applying ethical principles to consent. Make sure they understand that. Treat every client exactly the same. Wrong answer. No, we said equity. Recognizing social factors affecting what outcome? Social determinant of health. If you're going to take the NCLEX, please be ready to go. If you're not, step back. Prepare before you go and take this test. Don't rush. I got you. If you're ready, take it. If you're not, wait until you're ready. And if you end up taking it after April 1st, so be it, right? But you have to understand this little terminology. And this, you should come back to this video and understand these little things, put in your library and say, these are what they're trying to do. You already know them. Thank you. This is Adapting NCLEX. If this video helped you, share and put a like comment in the comment section. Say, and let us know how we're doing. Thank you very much and good luck.